And this is going to be a brief presentation of our paper. Basically, the title's a bit long, but it's self-supervised contrastive learning, momentum contrastive learning, and group patch embeddings to improve patient-level whole slide imagery classification. So first thing, our data was data taken from patients with colorectal cancer. Basically, there's two types of them, MSI and MSS. And we want to be able to classify between them because they can have significantly different treatment prospects. Obstacles to apply this, basically these images are enormous, so they don't fit on GPU, and also we don't know what's the best practices. So mostly ImageNet is like 256 by 256, and most other data sets are smaller than that. So we don't know what CNN filter sizes and stuff like that should be on them. So patch level and patient level classification are the two most critical things here. You can measure a patch classification basically as just the output of your network, which is usually some probability between 0 and 1. And in order to get a patient level classification from all the patches, you can take the basically average patch classification and use that as your patient level probability. And in order to get a classification for the threshold for like MSS or MSI, you can just threshold it between lower than T for being MSS and higher than some threshold for being MSI. A hypothesis was basically most of these methods have been training patch level classifiers, and you give like each patch a fuzzy label, which is the label of the patient. And you just train the network in the typical method that you would on ImageNet or something like that. We decided, well, let's train something in a self-supervised manner and then concatenate the embeddings of patches. And that way you can potentially have intra-patch information learned by the network, albeit self-supervised features, and maybe it'll improve network accuracy. And basically that's what we found. So our model, the first part of the model is MoCo, momentum contrast learning. Basically, it's the same way, just some specifics in the data loader stage, so that we don't ruin it basically. And in stage 2, we have a MLP that learns on groups of embeddings of patches, so that it learns a more general representation of patients. Results are that our patch level accuracy is significantly higher, and our patient level accuracy is also quite a bit higher. You can see that training is much faster, and the reason for that is because this is stage 2 training versus a regular ResNet being trained. We have two data sets, so we have here the standard data set, and the standard data set is a bit imbalanced, which is why we also tried testing on a balanced data set, where we got even better results, which shows that our method might have an even higher or less of a bias, which is nice to know. And that's all. Thank you.